This message is urgent for anyone living in the United States, United Kingdom, Canada, or Australia, countries where chronic kidney disease has quietly become one of the leading causes of death. You can lose 90% of your kidney function before even noticing any symptoms. That's why using the right supplements, not just random pills from the store, but ones backed by science, can be life-changing or even life-saving. In this first part, we will go through the top 7 supplements to save your kidneys, focusing on what they do, how they work, and why you need to care before damage becomes permanent. Kidney damage doesn't begin with pain. It begins silently, through years of inflammation, oxidative stress, and overload from toxins, medications, poor diet, and common conditions like high blood pressure or diabetes. And in countries like the United States, where ultra-processed food and high-sodium diets are everywhere, the kidneys are working overtime from childhood. You might be told your labs are fine, while inside, your nephrons are slowly dying. That's why N-acetylcysteine, NAC, deserves to be number 1 on this list. NAC helps your kidneys through a powerful mechanism. It's a precursor to glutathione, your body's most potent antioxidant, especially concentrated in the kidneys and liver. Without enough glutathione, your kidney cells become vulnerable to heavy metals, medications like NSAIDs or even antibiotics, and the inflammation triggered by high blood sugar. NAC has been used in hospitals in the United States for decades to protect kidneys before contrast dye procedures, and is also shown in research to reduce serum creatinine levels and improve eGFR in patients with chronic kidney disease. In real stories from dialysis nurses in Texas and California, patients who consistently took NAC under supervision often maintained their remaining kidney function longer than expected, and in some cases, avoided progression to dialysis for years, longer than predicted. Second on this list is omega-3 fatty acids, particularly those from fish oil in the form of EPA and DHA. In the United States, these are often used for heart support, but their anti-inflammatory role in the kidneys is often ignored. Inflammation is the silent killer of nephrons. When tiny filters in the kidneys become inflamed, they harden and die permanently. Omega-3s have been shown to reduce proteinuria, lower blood pressure, and reduce the progression of kidney disease in both diabetic and non-diabetic patients. In Canada and Australia, nephrologists often recommend fish oil to CKD patients, but many people still don't know the right dosage. You need a high-quality, pharmaceutical-grade fish oil, and the dose often needs to be around 2,000 millimol of EPA and DHA combined per day, much more than what is found in cheap over-the-counter capsules. A woman in Florida with lupus-related nephritis managed to stabilize her kidney function for over a decade, with aggressive omega-3 use, combined with lifestyle changes. It wasn't magic, it was biochemistry. The third supplement that must be talked about is coenzyme Q10, CoQ10. CoQ10 is not just a heart supplement. Kidneys use massive amounts of energy to filter 50 gallons of blood every day, and they need mitochondrial fuel to do it. CoQ10 supports mitochondrial energy production and reduces oxidative stress directly in the renal tissue. Clinical studies in the United Kingdom and United States have shown that CoQ10 supplementation can improve creatinine clearance and reduce the need for dialysis in early to mid-stage CKD. There's a critical detail here. Many Americans take the wrong form of CoQ10. Ubiquinone is cheaper but poorly absorbed. Ubiquinol is the active form, and while more expensive, it's what has been proven to actually work in kidney disease patients. People who took 200 mg of ubiquinol daily often experienced better energy, lower blood pressure, and measurable improvements in kidney markers within months. One man in Michigan with diabetic nephropathy saw a 20-point improvement in eGFR within 6 months of high-dose ubiquinol use, something his nephrologist called unexpected. But it wasn't unexpected. It was just underused knowledge. Next is astragalus, a traditional Chinese herb that's been studied in hundreds of trials for its kidney protective effects. Most Americans have never even heard of it, yet it's used widely in kidney clinics across Asia. Astragalus helps reduce proteinuria, enhances kidney blood flow, and stimulates immune modulation. In a US-based meta-analysis, researchers concluded that astragalus root significantly slowed the progression of chronic kidney disease and improved overall kidney function markers. One of its active compounds, astragaloside ivor, has been shown to inhibit the fibrotic pathways that cause scarring inside kidney tissues. This is a game-changer because fibrosis is irreversible. In Australian clinics treating early-stage CKD, herbalists often combine astragalus with lifestyle therapy to delay the need for medications. The most dramatic cases include individuals who were told they'd need dialysis in 2 years, yet still haven't started 8 years later, largely due to interventions that included astragalus. The form matters. Look for standardized extracts, not powdered root, and avoid poor-quality imports. Always discuss with your doctor, but this herb has decades of human data behind it. Another essential but overlooked supplement is magnesium, and it's shocking how many people in the United States are deficient. Magnesium deficiency contributes to elevated blood pressure, insulin resistance, and vascular calcification, all deadly for the kidneys. More than 60% of Americans don't get enough magnesium, and that's a major reason why kidney disease is rising even in younger adults. Magnesium helps regulate calcium metabolism, preventing kidney stones and vascular stiffness in the renal arteries. Studies from Canadian universities show that magnesium supplementation can improve insulin sensitivity and reduce markers of oxidative stress in CKD patients. But again, the type matters. Magnesium oxide is nearly useless for absorption. You need magnesium glycinate, citrate, or malate for effective cellular uptake. A patient in Pennsylvania who developed stage 3 CKD after years of high blood pressure reversed much of the damage after correcting her magnesium deficiency, switching to a low oxalate diet and supporting her kidneys with citrate-based magnesium. After 18 months, her GFR improved from 42 to 65. That is a medically significant reversal and shows how critical this mineral is. Next on this list is vitamin D3, which plays far more than a bone health role. People in the United States are constantly exposed to messages about vitamin D for immunity, especially post-2020. But kidney function depends on this nutrient at a deeper level. The kidneys activate vitamin D, converting it into its usable form, calcitriol. But when kidneys are stressed or damaged, this conversion becomes impaired, leading to downstream effects like secondary hyperparathyroidism, calcium imbalance, and increased inflammation. In CKD patients, maintaining optimal D3 levels has been shown to slow disease progression, reduce proteinuria, and stabilize blood calcium and phosphorus levels. In a large study published in the American Journal of Kidney Diseases, vitamin D3 supplementation improved survival rates and delayed the need for dialysis. In the United Kingdom, nephrologists often prescribe active vitamin D analogs, but in early stages, you can support yourself with cholecalciferol, D3, in doses ranging from 2,000 to 5,000 IU daily, depending on blood levels. A woman from Ohio who battled CKD after chemotherapy found that high-dose D3, combined with magnesium and omega-3s, drastically improved her quality of life and labs. After years of fatigue and bone pain, she regained energy and her eGFR stabilized. In the mid-50s, holding off dialysis. The final supplement for Part 1 is berberine, an alkaloid compound found in several plants, best known for blood sugar support. But what's rarely talked about in the U.S. mainstream health media is that berberine is also renoprotective. High blood sugar damages kidney filters, and berberine helps prevent this by activating AMPK, a master regulator of cellular energy and metabolism. It improves insulin sensitivity, reduces inflammation, and even has antibacterial properties that protect the urinary tract. In a study from the University of Toronto, diabetic patients who took berberine had lower creatinine levels, reduced proteinuria, and better blood sugar control without the side effects of typical medications. One patient in California who refused to take metformin due to gastrointestinal issues saw dramatic improvements with berberine combined with CoQ10 and magnesium. His fasting glucose dropped from 150 to 95, and his kidney function, which was slowly declining, plateaued for over 4 years. It's important to note that berberine can interact with medications, especially those processed by the liver, so any use should be supervised by a healthcare professional familiar with it. The usual effective dose is 500 milliliters taken 2 to 3 times daily with meals. Kidney damage can take years to appear, and once symptoms start, most damage is irreversible. But if caught early and supported with the right tools, progression can be stopped, or even reversed. And while pharmaceutical companies continue to push expensive drugs, many of these supplements have been shown to work synergistically with, or even independently of medications, often with fewer side effects. What makes it worse is that millions in the United States are completely unaware of these tools, even when they're struggling with early kidney dysfunction or risk factors like diabetes or high blood pressure. These aren't fringe ideas. This is data-backed, published science that people are not being told about. Another supplement that's becoming increasingly essential for kidney protection in the United States, especially for people dealing with high blood pressure or diabetes, is alpha-lipoic acid, ALA. This powerful antioxidant is both fat and water-soluble, which means it can travel to virtually every part of the cell and help reduce oxidative damage that slowly destroys the kidneys. ALA also regenerates other antioxidants like vitamin C, vitamin E, and glutathione, giving your kidneys a second line of defense. In diabetic patients, alpha-lipoic acid has been shown to reduce markers of inflammation, improve insulin sensitivity, and significantly lower the production of reactive oxygen species that cause microvascular damage in the kidneys. Studies in the United Kingdom and Canada reported improvements in glomerular filtration rates in patients using alpha-lipoic acid alongside standard care. This is especially important because oxidative stress is one of the first things to escalate in chronic kidney disease, even before creatinine levels start to rise. A patient from Arizona with type 2 diabetes and early-stage CKD started taking 600 milliliters of alpha-lipoic acid twice daily along with NAC and saw not only better blood sugar control but also a 15-point improvement in eGFR over 9 months. That's a big deal. And it's why many functional medicine doctors across the United States are now using ALA in protocols to help preserve kidney function, especially in high-risk patients. Probiotics are often forgotten in kidney health, but their role is absolutely critical. The gut and kidneys are deeply connected through what's called the gut-kidney axis, and when your microbiome is imbalanced, your kidneys suffer the consequences. In people with kidney disease, certain harmful gut bacteria overgrow and release toxins like indoxyl sulfate and picresol, which are absorbed into the bloodstream and must be filtered out by the kidneys. This adds more strain on an already burdened organ. But here's what people in the United States, Canada, and Australia are not being told. Targeted probiotic strains can reduce the production of these toxins at the source, Clinical trials using lactobacillus and bifidobacterium strains showed that probiotics not only improved gut health, but directly reduced uremic toxin levels, improved inflammation markers, and helped stabilize kidney function. There's even research from nephrology centers in the United States showing that probiotic supplementation reduced symptoms in dialysis patients, including fatigue and mental fog, which are linked to toxin buildup. A woman in Oregon with stage 4 CKD was struggling with bloating, skin itching, and persistent fatigue. After starting a kidney-focused probiotic and a fiber supplement, her symptoms significantly improved, and her labs became more stable over the next year. These results are not isolated. This is happening to thousands of people, but only if they're informed enough to take action. You won't find this advice in most standard kidney brochures handed out at hospitals across America. The next supplement that deserves serious attention is L-carnitine, especially for people already on dialysis or approaching end-stage kidney disease. L-carnitine helps transport fatty acids into the mitochondria to be used for energy, and patients with declining kidney function often suffer from severe fatigue, muscle weakness, and poor recovery from even minor physical activity. What many people don't know is that the kidneys play a big role in producing and regulating carnitine levels. And when kidney function drops, so does the body's ability to maintain adequate stores. In the United States, carnitine is sometimes given as an injection to dialysis patients, but this isn't always explained to earlier stage patients, even though oral supplementation can help well before dialysis is needed. Studies published in nephrology journals from the United Kingdom and Canada have shown that L-carnitine supplementation helps reduce inflammation, supports muscle mass, and improves overall energy and exercise capacity in people with CKD. One 58-year-old man in Georgia said he felt like he came back to life after starting L-carnitine. His muscle cramps lessened, his mood improved, and he no longer needed naps every afternoon. Most oral doses range between 1,000 to 2,000 milliliters daily and should be taken under guidance, but this supplement is absolutely critical for preserving both physical strength and mental well-being in people with struggling kidneys. Curcumin, the active compound in turmeric, has become popular in recent years, but its kidney-specific benefits are still underestimated. In people from Australia to California, it's used for arthritis, inflammation, and general wellness. But curcumin's impact on renal inflammation and fibrosis is incredibly powerful. Chronic kidney disease, whether from diabetes, hypertension, or autoimmune disease, always involves inflammation and eventually leads to fibrosis or scarring. This scarring is permanent, but curcumin has been shown to interfere with the pathways that cause this damage. Specifically, curcumin inhibits the NF-κB pathway, one of the key drivers of inflammation in kidney cells. In animal models, curcumin reduced kidney fibrosis, lowered creatinine, and even improved filtration rates. Human trials in India and follow-up. Studies in the United States show that patients taking high bioavailability curcumin formulations experienced reductions in proteinuria and better preservation of kidney function compared to control groups. A 45-year-old woman in Illinois with lupus nephritis started taking curcumin along with her prescribed medications, and within 6 months, her protein leakage in the urine dropped dramatically, and her GFR went from 38 to 52. Her rheumatologist didn't initially believe the supplement would make much difference, but her lab results said otherwise. It's important to use a form of curcumin that includes piperine or is formulated for absorption because plain turmeric powder isn't enough. Kidney health demands precision, not guesswork. Dandelion root extract is another hidden gem in kidney support, especially for people who suffer from fluid retention or mild edema. It acts as a natural diuretic without the potassium-wasting effects of pharmaceutical diuretics, which is especially important for people with compromised kidney function. In the United States, doctors often prescribe furosemide or hydrochlorothiazide to control swelling, but these drugs can cause major issues with electrolyte balance and can stress the kidneys long-term. Dandelion supports the urinary system gently, increasing urine flow while preserving key minerals like potassium and magnesium. Studies from herbal medicine departments in the United Kingdom and Canada have reported benefits in managing early signs of kidney overload, such as puffiness, bloating, and mild increases in blood pressure related to fluid retention. Anecdotally, a woman in British Columbia with stage 3 CKD used dandelion tea and extract to manage swelling in her legs and ankles. She reported that not only did her swelling go down, but her sleep improved, and her blood pressure readings became more stable, all without pharmaceutical drugs. The root also contains prebiotic compounds that support gut bacteria, linking back to the gut-kidney axis, making this a dual-purpose supplement that supports both detoxification and microbial balance. Another supplement people don't talk about enough is vitamin K2, especially in its MK7 form. Most people know about vitamin D, but vitamin K2 is what keeps calcium out of the kidneys and blood vessels and sends it to the bones where it belongs. In chronic kidney disease, vascular calcification is a deadly complication. Calcified arteries are stiff, don't deliver oxygen properly, and can raise blood pressure even further. Research from United States and Australia nephrology departments has shown that vitamin K2 deficiency is rampant in people with CKD, and supplementation with MK7 can reduce arterial calcification, lower inflammatory markers, and protect against cardiovascular complications, the leading cause of death in CKD patients. One man in Colorado who had moderate kidney dysfunction and a history of coronary artery disease started taking vitamin K2 with D3, and over 2 years, not only did his vascular imaging show slowed calcification progression, but his kidney function remained stable despite aging and other risk factors. This vitamin is not optional, it is vital, especially for people taking calcium supplements or vitamin D, both of which can cause problems if K2 is missing from the equation. Most people in the United States are completely unaware of how early kidney disease begins. They feel fine, their lab values might even be in range, yet their kidneys are under attack from every angle. Sugar, sodium, high blood pressure, medications, environmental toxins, and even poor hydration. And the worst part? Conventional care often waits until things get severe to act. Many people are told, watch and wait, or you're stable for now, but the truth is that waiting can mean permanent loss of kidney function. That's why these supplements are not just options, they are tools for survival. Not all supplements are equal, and not all bodies need the same combination, but these 14 supplements so far, if used wisely and with guidance, can create a foundation that protects, supports, and even improves kidney function before it's too late. And when paired with real lifestyle changes, the results can be dramatic. People who were once told they were on the road to dialysis have reversed that path with education, discipline, and action. These are not isolated miracles. This is what happens when you give the body what it truly needs. L-arginine is one of the most underrated supplements when it comes to kidney protection, and yet in the United States, Canada, and Australia, it's widely available and barely understood. For its real potential, L-arginine is a precursor to nitric oxide, a molecule that relaxes and dilates blood vessels, improving circulation to the kidneys. Healthy kidney function depends on a stable, consistent blood supply. When blood vessels leading to the kidneys are narrowed, whether from high blood pressure, diabetes, or vascular inflammation, filtration suffers and damage begins. Supplementing with L-arginine can help improve endothelial function, reduce glomerular pressure, and enhance oxygen and nutrient delivery to kidney cells. Clinical trials in the United Kingdom and U.S. populations have shown that L-arginine can help reduce hypertension and proteinuria in early-stage kidney disease, especially when combined with antioxidants like vitamin C. A patient in Texas dealing with stage 2 CKD and stubborn high blood pressure saw significant improvements in both blood pressure readings and kidney lab values after incorporating 3 grams of L-arginine daily under medical supervision. His systolic pressure dropped by 15 points, and protein leakage in his urine was reduced by over 40% after 4 months. These are critical changes that can delay or even prevent progression to more severe stages of kidney disease. But again, it has to be the right dose, and it has to be part of a comprehensive kidney protocol. Taurine is another amino acid with kidney-saving potential that has been ignored for too long in mainstream healthcare conversations across the United States. Taurine supports fluid balance, regulates calcium signaling in kidney tissues, and has strong antioxidant effects. Most importantly, taurine helps prevent glomerulosclerosis, a condition where the tiny filtering units inside the kidneys harden and scar. This is one of the most common processes leading to kidney failure. Taurine also improves blood flow within the kidneys and enhances mitochondrial performance, allowing for better cellular repair and energy metabolism in overworked kidney tissue. A clinical trial conducted in the United Kingdom found that taurine supplementation improved creatinine clearance and reduced oxidative damage in patients with diabetic nephropathy. In real-life cases, like a 50-year-old woman in Nevada with type 1 diabetes for over 20 years, taurine played a major role in stabilizing her kidney function. She started taking 2 grams of taurine daily, along with magnesium, vitamin D, and CoQ10, and within months her energy returned, and her nephrologist was shocked to find her GFR not only stabilized, but slightly improved. The truth is, taurine is not some exotic substance. It's inexpensive, safe, and available everywhere, but most people never hear about it unless they're doing their own deep research. Resveratrol, the polyphenol found in red grapes and certain berries, is another supplement that holds promise for kidney protection, especially through its anti-inflammatory and mitochondrial supporting effects. While it's mostly promoted for heart health or anti-aging benefits, resveratrol has demonstrated kidney-specific actions that can change the trajectory of early kidney decline. In animal studies and several human pilot trials, resveratrol was shown to reduce blood pressure, lower serum creatinine, and inhibit fibrotic pathways in the kidneys. These findings are particularly relevant to people in the United States and Australia, where high blood pressure and type 2 diabetes are among the top causes of kidney failure. Resveratrol activates SIRT1, a gene that supports cellular repair and longevity, and in the kidneys, this means reduced inflammation and protection against oxidative stress. A patient in Kentucky who had developed mild kidney damage after years of taking NSAIDs for chronic back pain saw improvement in his labs and inflammation markers after supplementing with resveratrol and switching to an anti-inflammatory diet. His creatinine dropped from 1.6 to 1.2 in under 6 months, a significant shift for someone his age and risk level. It's important to use trans resveratrol, the active form, and to pair it with fat or piperine for enhanced absorption. Cordyceps mushroom extract is another powerful agent with kidney-regenerating properties that has been used in traditional medicine across Asia for centuries. But it's finally getting clinical attention in Western countries like Canada and the United States. Cordyceps sinensis has been shown to protect kidney function, especially in patients with chronic nephritis or kidney damage from medications. It works by modulating immune function, reducing inflammation, and improving mitochondrial energy within renal tissue. It's one of the rare natural substances that can actually regulate creatinine and urea levels, which are key markers of kidney stress. In clinical studies involving CKD patients not yet on dialysis, those who took cordyceps experienced less fatigue, improved lab markers, and better quality of life. A man in Queensland, Australia, with early-stage kidney disease caused by high uric acid began taking cordyceps extract daily. Within a few months, his symptoms like swelling and fatigue had reduced, and his eGFR climbed from 55 to 68, giving him back years of functional kidney life. The results weren't magic. They were metabolic. The dosage typically used in studies ranges from 1,000 to 3,000 bilirubin daily of a concentrated extract standardized for active compounds like cordycepin. Olive leaf extract is rarely discussed in conventional nephrology, but carries serious benefits for protecting kidneys from high blood pressure and oxidative stress. Olive leaf is rich in oleuropein, a compound that reduces inflammation and helps to lower both systolic and diastolic blood pressure without harming the kidneys. In fact, olive leaf extract helps improve the elasticity of blood vessels, a crucial factor in maintaining kidney perfusion, especially in people with hypertension-induced kidney stress. A double-blind study conducted in Europe showed that patients taking olive leaf extract experienced significant reductions in blood pressure and improvements in renal plasma flow. A woman in Ohio with stage 3 CKD and long-standing hypertension began taking 1,000 ml of standardized olive leaf extract along with her prescribed medications. After 6 months, her doctor was surprised to find her blood pressure controlled with less medication, and her kidney labs improved to the point where her nephrologist said she no longer needed to be evaluated every 3 months. These are the results that never get public attention, even though they're happening every day behind the scenes in patient stories that never make headlines. Another supplement with emerging evidence for kidney support is sodium bicarbonate, not in the casual sense, but in the medical context. In the United States, thousands of people with CKD unknowingly suffer from metabolic acidosis, a condition where their blood becomes slightly too acidic due to the kidney's inability to balance pH properly. This low-grade acidosis accelerates kidney damage, muscle wasting, and bone loss. In fact, many nephrologists in Canada and Australia now monitor bicarbonate levels in CKD patients and supplement with baking soda under medical guidance to reduce kidney workload. A landmark U.S. study found that patients taking small, regular doses of sodium bicarbonate slowed the progression of kidney disease and had a 36% lower risk of requiring dialysis. This is a treatment hiding in plain sight. A man in North Carolina with stage 3B CKD began taking 1-2 teaspoon of baking soda dissolved in water twice daily under his doctor's supervision. Over a 12-month period, his acid-base balance normalized and his GFR stabilized at 43 without dropping further. It's critical that this supplement is used with proper medical oversight, but it's a clear example of how even the simplest tools can offer enormous protection for your kidneys when used correctly. Hydrogen water tablets or molecular hydrogen. Supplementation is an advanced but increasingly studied approach for people who want to aggressively support kidney health. Molecular hydrogen works by selectively targeting the most dangerous free radicals, like hydroxyl radicals, which are heavily involved in the oxidative damage seen in CKD. Research conducted in Japan and now replicated in studies in the United States show that hydrogen water can reduce inflammatory cytokines, support mitochondrial function, and reduce protein leakage in the urine. In a 12-week trial, CKD patients drinking hydrogen-rich water showed a decrease in urinary albumin excretion and improved antioxidant status. In one striking case from California, a man with IgA nephropathy, a chronic autoimmune kidney disease, began drinking hydrogen water twice daily and reported improved energy, reduced inflammation markers, and a modest improvement in kidney function over 6 months. Though this supplement is still new to many in the Western world, its use is growing rapidly among those who study renal oxidative stress. It's not a cure, but it may be one of the few interventions that can cross cellular membranes and protect mitochondria directly. B vitamins, particularly B6, B9, folate, and B12, are critically important in kidney health because they help manage homocysteine, a compound that, when elevated, becomes toxic to the vascular system. High homocysteine is linked to both kidney and cardiovascular disease and can worsen outcomes in CKD patients. In the United States, B vitamin deficiency is especially common in people with metabolic syndrome or poor diets, and yet doctors often overlook the impact of these deficiencies on kidney function. Research has shown that repleting these B vitamins can reduce homocysteine levels, improve red blood cell production, and support methylation pathways, all of which are important for kidney detoxification and energy. A patient in Michigan with stage 3 CKD was suffering from chronic fatigue and rising homocysteine levels. After being tested, she was found to be deficient in B12 and folate. After 3 months on a high-potency methylated B complex, not only did her homocysteine drop by 60%, but her eGFR improved, and her fatigue significantly lessened. The most effective forms of these vitamins are methylcobalamin for B12, L-methylfolate for folate, and P5P for B6. People in the United States, Canada, United Kingdom, and Australia are being left in the dark about what can actually protect their kidneys. The healthcare system often waits until the damage is already done, offering little more than symptom management. But there are dozens of nutritional tools that, when used correctly, can slow, stop, or even reverse early stages of kidney disease. These supplements are not hype. They are backed by human studies, real-life patient outcomes, and a deep understanding of renal physiology. Millions of people walk around every day with declining kidney function and no warning from their doctor. These supplements could be the difference between independence and dialysis, between long-term wellness and lifelong hospital visits. People deserve to know what's possible.